It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Hi everyone, I'm Sam Lesante, and today we got more healthcare information for you. Brought to you by Lehigh Valley Hospital, Hazleton. My friends, they keep on raising the bar on healthcare. But today, two interesting subjects, the Hazleton Patient Care Initiatives and also strokes and chest pain. What do we need to know? I'm happy to have Jody Shigo, who is the Vice President of Patient Care Services, and Vicki Riga, who is Stroke and Chest Pain Quality Specialist. Girls, thanks for coming on the show.
It's a pleasure.
Thanks for having us.
I always enjoy these shows. If people come up to us and, particularly they'll say thank you for having these help. It's providing information. It's always important to know what's happening. Hope I never have to use this stuff, but the point is, if we do, thank God we have you guys here, So in terms of the patient care services, Jody, first of all, tell me about yourself.
So, my name is Jody Shigo. I am the Vice President of Patient Care Services here at the Hazleton campus. I'm not a native of Pennsylvania, but I call Pennsylvania.
Sorry to hear that.
I call northeastern Pennsylvania my home for the last 30 some odd years. I'm a very passionate nurse. I'm passionate about healthcare and maximizing the outcomes for our patients. So I'm so thrilled to be here to talk to you today.
Good. So tell me, when you're looking at the position you have, what primarily is your role?
As a nurse and as the chief nursing officer of my campus, all nurses have to report to me in some matrix, whether they're a direct report or a dotted line to me, because nursing has to come under my umbrella. I set the standards for how nurses care and behave and advance their professionalism within the campus.
When you're looking at quality care and you're looking at patient care services, how do you know what to look for, okay, and how do you know what to do?
So there's so many different ways that we do that. We have standard policies and procedures that are evidence-based that we set as our standard of care. My job is to make sure that people are abiding by those standards of care day in and day out, and then we're not deviating from any practice concerns. We have different, as I said, policies and procedures, but also how we're trained to take care of our patients is important. There are many regulatory agencies that monitor our adherence to our quality guidelines. They help us to up our quality guidelines. So my job with my colleague in quality is to make sure that we're always doing that on a day-to-day basis.
It's a tough ride, being a registered nurse, working in a hospital, because you're always on demand. And one of the things that I think, these nurses have is what they call patience, because it's a difficult task when you have a patient who is in trouble. How do you handle that troubled patient who wants an answer now, and where's the doctor, and how come I did this, and why do it's not that they mean to do that, it's just that they're not feeling well.
Correct.
What do you do there?
So, one of the things we always tell our nursing staff, and it's not just nurses, it's everybody who touches the patient, is that we have to understand that our patients are coming to us, as you said, they're not at their best. They're ill, they're not feeling well, they're out of their comfort zone. Our job is always to put that foremost in our mind and to kind of not pay attention to the noise. A patient can be upset with us, a family can be upset, but we have to understand that they're going through something that we have to help them with. So I always say to my nurses and my staff that touch a patient is, leave whatever trauma you have at the door, because your day is dedicated to the betterment of your patients.
Yeah. And how do you put those initiatives? Now, let's assume, we're all human, and sometimes we get to up here, and I've had it up to here. I don't know how many times you've heard that. Jody, I've had it up to here with that person. What initiatives, do you put in effect that, it could take some of the attention?
Sure, so that's a great question. One of the things we really focus on is wellness for our staff. So we just celebrated Nurses Week, Nurses Month last month. We offered our nurses and our staff wellness opportunities. We wanted them to get off the floors for a little bit. We offered them massages during Nurses Week and other ways of managing their own stressors, because we all live with stress in our lives, and we have to forget that when we come in the door. So anything that we can offer our nurses to help them deal with the stress of caring for someone who's very ill or caring for a small child or caring for an infant who's ill is going to help them. And we have to continually look past the noise, as I said, and just look at our patient. And I daily try to remind our staff why we're here. In fact, the tagline on my email is never forget, no matter how hard the days get, never forget the reason you became a nurse.
Once in a while you have a person who has just been stressed, they're running here and running there, okay? How do you control that?
So I have a great leadership team, and they really care about their staff. So they're out on the floors, they're touching base with their staff daily to see who's struggling, who needs help. And I think we do a really good job, at least in patient care services, of fostering that kind of care amongst the team. Because as you said, if someone's having a really bad day, it's up to us to step in and say, what can we do for you today? Because tomorrow you're going to have a good day, and you're going to help the person who's not having a good day.
The patient sometimes wants to know what the doctor has to say, okay? And the nurse knows that the doctor was just here and told you to give him this and this and this. How do you handle that situation where they're demanding, I want to talk to my doctor, I want to know what he says, I want this, okay? Because that initial contact is sometimes very hard.
It is, and our doctors are pulled in so many different directions.
I know.
So we have something called care progression rounds. So that's when the doctors and the nurses all get together, as well as our case managers, and talk about each of the patients. And it kind of marries up the communication gap that we can sometimes have in healthcare. So the nurses have an opportunity to ask the doctors, what's the plan, what do you want to do? Or they can say, Dr. Jones, Mrs. Jones in room 6 wants to see you. Can you please make that a priority? So it happens day in and day out, usually twice a day, early in the morning and then earlier in the afternoon.
How many nurses do you have that you?
Well, I have about 200 nurses.
When you look at the medical profession, there's such a change that was happening this year versus 5, 6, 7 years ago. How do you adjust to those changes?
There's a lot of change coming at us, and I think technology is probably the biggest change. And leveraging technology to make the nurses' work-life balance a little bit better is a primary focus for the hospital campus and for the network. So I'll just give you a for instance.
Yes, please.
During COVID, when resources were very slim and you couldn't have people come into the hospitals, we instituted something called telehealth virtual nursing. That was at a different campus, certainly not our campus, but it was done so we could free up the nurse, have another nurse at a distant location looking at the patient to make sure patients got everything that they needed. It didn't work terribly well for COVID, but what it did work for was other workflow issues. So we're now looking at that at Hazleton to bring virtual nursing into our campus to assist our nurses. So that would mean that a nurse sitting in an office in Allentown can dial in and talk to you and say, Mr. Lesante, what can I do for you today? The nurse, here's what the doctor has in your chart, here's what the plan is. It's just another layer of communication with our patients. So it's not public yet, but it will be soon. I'm very
Aren't they
excited.
doing that with the doctors now too?
We do. We have a lot of telehealth initiatives. We have, oh my gosh, tele-infection diseases.
This is fantastic.
It's amazing. We have teleneurology, we have telepulmonology, we have tele-neonatology for our smallest patients. So now we're leveraging on that technology to bring more help to the bedside nurse. So the docs really have it hardwired. Now we have to bring it to the next level.
The interesting thing about being an RN is LPMs, and they're all fabulous, is knowing what to do when. Okay, because sometimes there's critical times that happen either during the night, maybe or during the day. It's knowing how to react and doing what you're doing. So that's where the training comes in.
Yes.
What do you think the future looks like in healthcare?
I think the future is even more technology, and I think it's going to be even more simulation. So simulation is something that was brought in about 10 or so years ago to kind of help nurses train when they were in nursing school, and then we relied on simulation very heavily during COVID. So our student nurses really couldn't go into the hospital, so they did a lot on these very high-tech mannequins through simulation. And I think that is going to be another wave of the future, that we see even more immersion in simulation. And with the advent of AI initiatives, I think that will also factor into
it. Must be fascinating for you, though, as you see the transgression that's happening in healthcare, isn't it? It's like in our industry. At one time, these cameras were 4 times bigger than what they are, And I'm looking at here, what are NRC patient surveys?
So NRC is a survey for our patient experience. It's a real-time survey. So if our patient comes in, they have a stay in our hospital, or they go to our health and wellness center or a physician's office, this company called NRC sends them a survey. They'll either text it to them, they'll call them, email, and it's to get us real-time feedback as to how we're doing. I've done them because I've been a patient, and really it gives you the opportunity to say, oh my gosh, Vicki was an incredible nurse. I really think, she did a fabulous job. Or, I waited too long in the emergency department. You really need to work on that. So it gives us a better chance to move on things a little bit quicker.
And I know for a fact that these surveys are very important because I know Terry, Tammy, and everyone, you look at these, and the interesting thing is how you keep on top of these things and respond, okay? How do you tell a nurse, or what do you do for a nurse who has been under a lot of stress? It's very easily to say, and I used to say this with all my employees when I had my stores, check your emotions at the door. But God forbid something just happened to your son, your daughter, your family, et cetera, and now you have to go to work, and especially in the medical industry. What comfort do you give to that person so they're able to achieve the duties for the day?
Sure. So I think, I want all of your viewers to know that we have something called a just culture. And that means that you're not holding people negatively accountable for things that happen. So we have to understand that our healthcare team are human beings subject to the same emotions that their patients are. Yeah, exactly. And the first thing we need to do if they're coming in and they're having an event is comfort them and to let them know that we are here for them. And as I said earlier, if they're not having a good day today, tomorrow's going to be a better day.
And the other thing I think is so important is that the nurse is under enough stress the way it is. I think when you have a patient in there and the family comes in, it's comforting for the family to let the patient know that, hey, Vicki's trying to do her best, Jody's trying to do her best to comfort that person so they're not as hard on the nurse as possible. Do you think that's a good idea?
I think it is. I think something called managing up is what we need to do a better job of. We're in the infancy stages of doing that. So if I'm giving a report to Vicki and you're my patient, I will say to you, I would give a report in front of you, Sam, and I would say to Vicki, this is Sam, he's been my patient all day. Vicki's going to take care of you tonight. She's a phenomenal nurse, and you're going to be in great hands.
Okay.
So the more we do that in a meaningful manner, not just because we're being told to do it, really does help our patients understand that we are a really good caregiving team.
So Jody, let me ask you this question. Since 1994, I've been doing these shows, and I've been talking about our health care back then. And we had, before that, in the 80s and 70s, people, if you needed any kind of medical care, get out of Hazleton, okay? That has certainly changed immensely throughout the years. So what do you tell the community about our local hospital?
So I worked at Cedar Crest, Lehigh Valley Cedar Crest, for 15 years. I was a bedside nurse, I was a manager, I was a director, and thought the care was exceptional and loved my time there. Left that organization, and then when an opportunity came to me to come to Hazleton, I jumped at it. I have been here for almost 6 years, and I can tell you this is probably the best experience I've ever had as a nurse.
Wow, that's great.
Ever. This team is second to none. I mean, this is a great nursing team, ancillary team. We are a passionate, dedicated group of providers. And the thing I think that's so special about Hazleton is we really care for the members of the community. I see the same patients over and over and over again, and I care about them.
The only problem about you, Jody, is you have to become a little bit more enthusiastic.
I'm a very enthusiastic nurse.
That's good. Well, my hat's off to anyone in the medical profession. It's a tough task. Folks, we're talking to Jody Shigo, who's the Vice President of Patient Care Services, coming up with Vicki Riga, Stroke and Chest Pain Quality Specialist. Hope I never have to see her. Be back after this. Welcome back to the Sam Lesante Show, folks. We're talking about healthcare, brought to you by Lehigh Valley Hospital, Hazleton. As you know, my friends, a lot of great things happening. If you just tuned in, we're on 24/7 on ssptv.com. Go to our website, and you'll see all the shows we do there. Also YouTube, for those of you who do not have cable. Should have cable, but if you don't, go there and you'll get a lot of good health information. We talked to Jody Shigo, who was the Vice President of Patient Care Services. Now we're going to be talking to Vicki Riga, who is the Stroke and Chest Pain Quality Specialist. Hello.
Hello.
I know you were upset because I was talking to her.
That's okay.
You were saying, when's my turn? Well, now it's your turn. So tell me about yourself. Vicki.
So my name is Vicki Riga. I am the Stroke and Chest Pain Quality Specialist for the Hazleton campus. I have been with the Health Network for 22 years. Majority of it in the ER. I was on the mobile stroke unit briefly, and then we placed it out of service, and I decided to do something different than bedside. So I chose to come up here to Hazleton to do this position.
Okay, so the question is, when you say specialist,
Yes.
okay, what does that mean?
So I oversee the chest pain and stroke programs at Hazleton. I do a lot of data pulling. I do some process improvement, and I facilitate the stroke alerts and the MI alerts that we have at the hospital when they come in through the emergency department or if they're in the inpatient units.
Okay, before we get into the details, okay, tell me, we're accredited chest pain center. What does that mean?
So we're accredited by the American College of Cardiology. We were reaccredited in June of last year. It's a body that oversees us and gives us standards of care for patient care and treatment and metrics that we have to follow.
And so you're a primary stroke center.
Correct.
Meaning?
Meaning that we are capable of giving a clot-busting medication called TNK, and I'll explain that in a little bit. The medication to help bust the clot that you have in your brain, and we can provide further care if we need to transport you to Cedar Crest.
Okay, so how common are strokes?
They are more common in men. They're more common in an African American population.
Okay, and why is that?
They just have genetics that make them more predisposed to having a stroke.
What are some of the primary signs and symptoms of a stroke?
Okay. Most likely you can see facial droop, which is when the one side of your face is more relaxed looking than the other side. You can have what we call weakness of one side of your body, either the left side or the right side, and it's both mostly your arm and your leg. You can also have numbness of those extremities. You can have vision changes. You can have dizziness, and you can have what we call ataxia, which is like imbalance. You're walking like you're drunk.
Okay, so two areas here. Number one, you're by yourself.
Yeah.
And you start feeling these symptoms, okay? What do you do?
Call 911.
911.
Or call somebody who may be able to contact 911 if you can't remember how to do that. Or if you are just having like speech issues, you could drive yourself to either an urgent care or the local ER.
So what do you do then when they come in?
So what happens when they come in is if you come in through the waiting room, we'll take you to a room immediately. You get a evaluation by a ER provider, a doctor, and they do a quick assessment of you just to make sure that you're stable enough to go over to CAT scan, that you don't need any immediate intervention as for like breathing or your heart rate. And then we take you over to CAT scan emergently. You get a CAT scan of your head. And then based on that CAT scan, kind of depends on what kind of treatment we do. When you come back to your room, you'll be seen by a stroke neurologist via telestroke medicine.
If you're at home, what should family members do? Same thing?
Same thing.
Is there anything they could give the patient or the person?
I would not give a patient anything. They may have some difficulty swallowing, which could lead to other complications down the road.
Okay, so you're evaluating that person coming in with these particular patients as soon as it comes in. So you know what, is there a certain medicine they have now that they give the stroke patients that you should get?
Yeah, as I mentioned before, we have a medication called TNK.
TNK?
TNK is called tenecteplase.
Okay.
It is a clot-busting medication that is a derivative of a natural clot-busting medication in your body that we can administer it right at bedside over 5 seconds, and it helps to dissolve that clot in your brain.
But how do you know when to give that?
Well, it's kind of based on the symptoms that you're presenting, and on the CAT scan, if we see certain things on the CAT scan, we can see the clots.
So you don't
your
give
brain.
that until you're double.
Correct. We have to have a CAT scan first to make sure that you don't have any blood in your brain, because this medication can increase bleeding in your body.
So what's the time factor here? I mean, when is the critical point? I mean,
You have between 0 hours and 4.5 hours to give the medication. After that, you can increase your incidence to bleed.
So that's why it's so important. If
Correct, to get there fast.
To get there as quickly as you can. Okay. What are the treatments for the stroke? You said the medicine that you're going to give them.
Correct.
Okay.
Another treatment we have is called a thrombectomy. Now that is completed down at our Cedar Crest campus. But essentially what happens is a doctor will insert a catheter into, I believe it's your groin, and bring it up to your head, and they can retrieve that clot out of your brain, out of that vessel that's causing you to have symptoms.
When we talked about the latest technology, in terms of many years ago when you had a stroke, it was difficult, okay? What are some of the percentages of success with stroke victims?
I'm not sure of the exact percentage, but the faster that you receive care, the better your chances are for a greater outcome.
Okay, moving on to chest pain. What does this mean, your chest pain center accreditation?
Correct. We are accredited. We got our reaccreditation in June of last year. And it's also a body that we have that gives us standards of care with treatments and health care and metrics that we have to provide.
Okay, now chest pain.
Yeah.
That's something where people think, oh, they got heartburn, it's nothing really serious. How do you know where that breaking point is that, you should address? Because if you're, sometimes people get some pains, but some chest pain. I mean, when do you call the 911, or when do you do something about it?
I would say when you have like chest pain with like shortness of breath, you're getting sweaty, you have pain in like your neck or your jaw, and on the left side of your body, in your arm mainly.
What do you do then? I call 911, or do I have, if I'm capable enough, someone taking me to the hospital?
Correct.
Okay.
So if you call 911, we bring you into a room right away. You get a physician evaluation immediately, and we also do an EKG, which is an electrical tracing of your heart.
So here's the concern I have. You want to get that person into the hospital as quickly as possible, but yet you want to make sure they get the proper care.
Right.
So when 911 coming, they're already prepared to do
Correct.
something. Okay, so the question is, do I take them up myself or her up myself, or do I get 911 and wait till they come here so they can administer? So that would be a question that I would have.
So you can take aspirin. We do suggest 4 baby chewable aspirins. You can take 4 of those. If you don't, when you do call 911, they do administer those. They do give those to you. And they also can give you nitroglycerin. Or if you're having like some sort of arrhythmia, they can give you medications to help with that.
Tell me about the care that you have at our local hospital as Jody.
I am amazed by the team that I work with. They are phenomenal. We are set to a standard that I believe trumps all others. Our metrics are some of the best in the hospital within our health network. And the care that you will receive will be excellent that you get from us.
Well, first of all, I totally agree with you. I hope I never have to see the both of you.
Not either.
I want to see you like this. But in case something should happen, that's the whole important thing. We know we're covered, okay? Phone number's on the screen, my friend. I want to thank Jody and Vicki for coming on. It was certainly nice to meet the both of you. And all I can say is keep up the good work, and kudos to all of you people in healthcare. Folks, once again, thanks for making us the #1 talk show in Northeastern Pennsylvania. All these shows, all our health shows are on our website. We're known as the Healthcare Station. We're proud of that, and it's here to help you. We'll see you next time.